Alright guys, now it's time to talk about my 4-month process of the ACL. But before I do, I want to answer a couple questions that I've been asked about my process and how everything's been going. So I'm going to answer a couple questions that I've been commonly asked. Alright guys, on my phone I have the questions. So first, what is the ACL? The ACL is the anterior cruciate ligament that attaches your femur to your tibia bone and pretty much stops your tibia and femur from translating forward. So it's super important for turning, changing directions, sides, lateral movements. You need an ACL, guys, and it's extremely important. Alright, another commonly asked question is, what causes the ACL injuries? And so in my instance, I got kicked right on the knee, and literally, guys, it was the worst pain. I've never felt so much pain in my life. But a lot of times it can also happen either by contact, so somebody hits you right in the knee, and boom, it's like done. You know it's done. And then lastly, it can also change the direction. Your knee just pops out, and boom, you're having a lot of pain. So usually those are the two most common things. The other question I've been asked is, what sport usually happens? Like, where does this injury usually occur and what sports? And that's soccer, volleyball, basketball. So any sport really that makes you change direction at a rapid pace, or just a really high contact sport. The next commonly asked question is, how do you know you tore your ACL and what are the symptoms? So very often you hear a popping sound, like a quick pop. I didn't hear that in my instance, but that is very common, and that's followed along with swelling, lots of pain, and an inability to change directions, walk, and I'm telling you guys, like, you'll know the pain that just follows after that contact or change of direction. I'm telling you guys, it's so, oh man, just like remembering it right now, it's like just like making me sick, because I'm like, it's just that painful, guys. Like, you just know there's something wrong. So when I got kicked right in the knee, I knew, I didn't hear a pop, but I knew there was something immediately wrong, because I started crying. I like got up, I couldn't put any weight on my leg. I couldn't walk for 3 weeks, guys. I couldn't walk for 3 weeks. And then that's my next question. So what happens after the injury? And after the injury, you need to go to your family doctor or a specialist to get an x-ray, and more importantly an MRI, just to see if it's your ACL. In most often cases, it's gonna be your ACL if your knee's like that puffed up and swollen and that much pain, guys. So I'm telling you, it's not gonna get any better. The swellingness will go down, but you'll notice you'll have like such an instability in your knee, and you won't even be able to turn. I'm telling you guys, you will know. Make sure you go to a specialist, get an MRI and an x-ray, just to make sure everything is like either intact or it's not, and it's usually in most cases not. Alright guys, so after you get your x-ray, MRI, you find out it's a torn ACL, which sucks. Long recovery, but it'll be okay. You're gonna have to have 3 treatment options. You're gonna have a cadaver, a patella graft, or a hamstring graft. My case, I had a hamstring graft, but I'll explain that really quickly. So first, the cadaver is the worst graft to have because it comes from another body, so somebody else. So it's foreign to your body. So there's a potential of error because it's not, your body's not going to accept it. And then secondly, there's the hamstring graft, which is the best graft. It's a good graft, but not, it depends on the individual. That's how I put it. It depends on the individual. So for instance, the front of my knee always hurts when I play soccer, or just like swells up. So you want to use a hamstring graft in that case, because your hamstring will ensure that you don't get that pain in the front of your knee. Because then you have a patella graft, which is your best graft overall because it has bone-on-bone fusion. So they take portions of your tibia and your knee and they fuse it into your ACL section. So I'll replace it, and since it has those 2 strips of bone on each side of the ligament, it'll fuse really well into your body. You have the best acceptance rate, the best strength, but that also leads to a lot of pain in the front of your knee. And I knew already that I was predisposed to pain in the front of my knee, so that's why I went with the hamstring graft. And a lot of studies have shown that both the hamstring graft and the patella graft are just as good as one of each other. So that's why I went with the hamstring graft. Alright guys, so we are almost done. Last question, and that question is, how's the recovery? So the recovery is pretty much 6 to about 10 to 12 months. So 6 months you'll be like totally normal. You'll be able to do whatever you want, but you're gonna have to be careful because you know, you can't be like playing full contact sports yet, but you can like juggle a soccer ball, like kick it around, just have fun, just nothing like super crazy intense. At 10 months you can do whatever the heck you want, but obviously you're gonna be a little scared. You gotta like gradually work yourself into the sport of choice. For instance, mine's soccer, that's why I have all these soccer examples. And then at 12 months you're like fully set, full recovery, no worries. But I'm telling you guys, the first month is hell. Like, you won't be able to do anything. Have to keep your leg elevated. Make sure to do your therapy sessions. Like, you need therapy assessing how well you're doing, and you gotta make sure that you're gradually getting better every single day. You need to go to physical therapy. Like, if there's anything that you get out of this video, is you need to go to physical therapy, because they'll make sure you're following the exact protocols and that everything is going right. And now we'll just jump straight to my leg and how I feel 4 months. If you're more interested in how the first month, first couple weeks to the first month, second month, third month, and now the 4th month are, make sure to click here, and that will show you guys a couple videos that I've already made of the exercises and how everything's going for me. Alright guys, so this is a weird angle, but as you can tell, my left knee is the one that I got operated on. You can tell here is a scar. You got another scar right here. You can tell they're harder to see now for sure. And then I got this one right here, and you can definitely still feel the scar tissue in them, but I've been rubbing them out with vitamin E oil. So you just take the vitamin E oil, start rubbing it, and it pretty much will just make the scar tissue go down. And it's important to get rid of scar tissue. I know a lot of people are like, what's so important about getting rid of the scar tissue? Well, scar tissue will prohibit your mobility, and it'll also make you feel more sore. So the more you get rid of it, the better overall you'll feel. And in comparison to the one that I got non-operated, you can see guys, I am flexing them right now. You can tell like this is just nice and flush and thin. It looks good. And this one, you can tell like there's still some swelling right here in this pocket and some here in the outside, and it's gonna take about 2 years for it to like look just like your normal knee and make it look like nothing happened. So it's okay. There's a lot of popping in my knee. It hurts in the morning. If it's raining outside, my knee hurts, so that's definitely a thing that's normal. If you push yourself like really hard and forget to ice, your knee's definitely gonna hurt. You need to ice like 2 to 3 times a day for sure for a good recovery, and make sure you're always moving it. It does really get stiff on me a lot. So that's pretty much how it is in 4 months. It's still popping, still stiff sometimes, feels weak at times, at moments, but it's definitely feeling a lot more sturdy, and I definitely feel more confident. Alright guys, so that is it for today. Make sure to like, comment, and subscribe down below. If you have any questions, please leave them down below, because I want to help you guys. When I tore my ACL, I was on YouTube all the time trying to figure out what the best option was, and that's why I decided to go with the hamstring graft. And of course, I was just, seeing how it is, like what is the next you're gonna be like now that I tore my ACL. So if you guys appreciate the content, make sure to like, subscribe, and comment down below anything that will that you have on your mind, guys. Just comment down below and I will answer it, and make sure to respond as quickly as I can. Once again, thanks for watching, guys. I always appreciate you guys. I can't believe we're at 141. That is awesome. My goal is to get to 200 by the end of the summer, so let's make that happen. But thank you for all the support, guys, and I really appreciate it. Make sure to stay tuned to the next video, because I'll be having all my 4-month exercises in one video for you guys to watch. So stay tuned for that, okay? And let's just have a great weekend. The truth.